excited. We're live in Ibadan, in the ancient city with Dr. Ima, the brain behind the Light Hospital, one of the biggest IVF center in the heart of Ibadan, the city of Ibadan, the ancient city. Oga, like I told you he's not a social media savvy person. He's extremely busy. In case you've been trying to get in touch with him, all to no avail. Of course, it's not his fault. I had to practically drag him out of the surgery room, the theater, to have a short chat with him. Sir, we wanted to tell all your friends, your clients all over the world, we wanted to wish them Happy New Year.
We thank God. At least the year is running to an end, and we want to appreciate everybody that has been to this place. Most of our patients, especially those people that God has granted their heart desires in this our center, want to wish everyone of you Happy New Year, and at least Merry Christmas and Happy New Year in advance. We also want to consider those ones that are still coming and those presently on treatment, that we wish them a fulfilled year, and starting the new year with the result of their heart desires.
Amen. Amen. So how old is the Light Hospitals? The Light Hospital. Wow.
So we're 10 years old this year, and to the glory of God, at least we have enormous baby to show forth.
Wow. Like how many babies has the Light Hospital given birth to in the last 10 years?
We cannot count the statistics because we have babies all over the world, and we have pregnancy every day. We deliver almost every day all over the world. Bless God for all. But we have a specialized program for the babies in the center, which we celebrate them every year. We select a few, maybe about 200 in Ibadan. Every June and December.
Your baby is like 200 in Ibadan.
Because we have to limit their numbers. Because last year when we were counting those ones in Ibadan, was it not close to, at least the one they can count.
In 1 year.
We have to about 800 or something like that.
Wow.
We have to
in 1 year, imagine that. Imagine. Sir, people ask, why does IVF fail? I think that is the only question I'll ask. I know you're very busy, so that I can let you do your work. Why do people experience IVF failing?
There are so many factors with failures in IVF. Number one is the patient. The problem is the inability to take a very good history from the patient, then examine the patient and be able to give the patient appropriate treatment. We have some patients that are having the issue with their egg quality, and such a patient still want to try others, though sometimes with the level of the treatment we have this day, we can get some of the results out in a single day, and we'll be able to predict either they are going to do well or not. But some people can still proceed and they can give us a low quality embryo. Most of the time we cancel that one and we start again. So, but notwithstanding, if everything is done properly, most of the time we can actually predict the success in IVF. Most of my patients, I congratulate them on the transfer table when everything is 100% perfect, and the result is almost always like that most of the time. Because if there is no problem, everything's supposed to be perfect. So it's just like it's something that you have to program, and we are expecting
I remember you congratulated me on the day of the transfer.
Yes. Most of the time when I do that, that means I didn't have anything to that. Occasionally when I have something that maybe in the course of the transfer, we have difficulty in transfer, some we have fibroids, we have some stenosis in the course of, although that was supposed to have been resolved before the transfer process. But sometimes we still encounter such, depending on the type of transfer catheter. The choice of our catheter is also very important. So if you encounter a problem in the course of transfer, it can also affect our result. Then in terms of patient managing themselves, some patients after transfer, they go with their normal activities, I see most of the people actually do. But we some get good results, some we still have to repeat the test. So usually advocate some review of first post transfer so that then they can have chance to have listen to implants. We study some of them and we believe that at least it is working for them. And the other reason may be because of the fact that some may be having some problem with additions like Cashman syndrome, uterine synechial, which we need to prepare the embryo additionalisis before the transfer. Some may have problem with the fibroids, which may be having some degenerative changes like having degenerations and cystic degeneration, and some may be having some fluid discharge from the endometrium. When you want to transfer, looking at the media we used to transfer, it's more or less like those fluid discharge will contaminate the embryo, so now affecting the embryo from implant. Such we need to go for surgery to remove those fibroids before good implantation can take place. Then we have some other people that maybe they have gynecomastia. Able to transfer may be difficult, so we need to have some, though if we can get to the through the service to the job, the anesthesia may not pose a threat to IVF if there is a passage of transfer catheter. But in some, they tend to have an infection there, and that one we need to do vaginoplasty before we proceed. They also the cause of IVF failure. Then sometimes some other people's sperm.
Can you see my doctor going on? Let me. I want to cut him short there because I know a lot of people will want to say that is it possible for